Hello friends, I'm Dr. Vijay Prakash and today I'll be telling you about troubleshooting in cast partial dentures. Now, majorly at the time of insertion, this is the time where it is a culmination of expectation by the patient that he is going to get the final outcome. He gets to see the final outcome of his treatment and of the dentist who has planned the processes to ensure that it has accurate fit, proper retention, aesthetics and comfort. Now, troubleshooting in cast partial dentures can be at the time of insertion and it could be during post-insertion. Now, let us see troubleshooting at the time of insertion. We can divide that problems encountered which are regarding the proper fit of the denture base, one. Secondly, there can be occlusal discrepancies, and thirdly, there could be problems with retention of the problems regarding the fit. If we see the cast partial dentures framework should not be checked for accurate fit at this stage, because that should have been checked at the time when we are doing the cast metal framework trying. So after that, what we have done, we had taken the jaw relation and did the aesthetic try-in, and then finally you had the denture base. So you may have problem because of the denture base, because there could be polymerization shrinkage at the time of processing. So processing errors can be there because of the denture base. So you may have problem during the fit because of this area, that is the impression surface of the denture base region. Now, for this region, what you can do, you can apply the pressure indicating paste with the help of brush on this area at these borders, and then you can try it in the patient's mouth. Wherever you see that the paste is being removed, that is indicating that there is some kind of interference and that needs to be trimmed with the help of an abrasive stone. Now, pressure indicating paste can also be used to identify if there are any overextensions, or is it interfering the soft tissue in any reason on movement. So those areas you can grind with the help of appropriate abrasive, and after grinding you have to polish it well so that it does not have roughness and it does not irritate the soft tissues. Next kind of troubleshooting could be the occlusal discrepancy. Now, at the time of insertion, occlusal discrepancy can occur on the artificial teeth, which you can see here on the artificial teeth. As the patient bite, there could be some kind of premature contacts, and if there are any, you have to check it with the help of an articulating paper, and if there are any, you should grind that. Now, whenever we are doing grinding, you should use a selective grinding approach. In this, you have to reduce the inclines of the cuspal inclines, not the cusp of the denture. Because if you are reducing the cusp of the teeth, then you will be actually compromising on the vertical height of the denture. And that is the reason you should grind the cuspal inclines or deepen the fossa, whatever the case may be. Accordingly, you can adjust and address the occlusal discrepancy problem. Another way in which we can do this is by laboratory remounting procedures, and where the completed partial denture is remounted on the articulator, and any occlusal discrepancy is identified and corrected on the articulator itself. So this will help in saving the chairside time. Other troubleshooting can be, the patient may complain of loose denture. There could be retention problem. So at the time of insertion, so what you need to do, you can adjust the occlusal clasp. These clasps you can adjust with using orthodontic pliers. So you have various pliers with you. So any discrepancy you can use and adjust. But you make sure that you don't apply too much of force when you are adjusting the clasp, because these are rigid clasps, and chances if you are applying too much of force, then chances are that they may break. Apart from this, troubleshooting can occur during post insertion. Now once you have inserted the denture, you call the patient after a day, that is after 24 hours, and you have to check for any irritation of the soft tissue or any irritation of the hard tissue, or there could be miscellaneous problems. So troubleshooting because of irritation of the soft tissues can be due to overextended denture base. As I said that when we were checking the fit of the prosthesis, that same thing which you have to follow, you have to apply the pressure indicating placed on the concerned side and with the help of a brush, and then again place it there and check for the movement. If the pressure indicating paste wipes off, that means there is overextension and you need to reduce. Check for any signs like soreness or ulceration of the soft tissues that indicates that there is interference in their movement, and that needs to be grinded with the help of appropriate abrasive. After grinding, you need to polish it so that you don't have roughness there and it is comfortable to the patient. Apart from this, you can prescribe a topical anesthetic gel to the patient to apply in the local area in the ulcer 2-3 days, which the patient can use this. Next problem can be on the tissue side of the denture base, which the patient complains of roughness. Now you have to identify a particular place on the denture surface, that is the tissue side of the denture, and check for any roughness there. You may find it difficult. You may then use your pressure indicating place, and accordingly, as we have just told you about the overextension, use it in the similar way and check the particular point where roughness is there. Accordingly, you have to grind that with appropriate abrasive and finish and polish. Now, you should not grind too much of the tissue surface because that will compromise on the retention and stability of the prosthesis. Third troubleshooting can be because of the occlusal premature contact. Any premature contact is identified and reduced accordingly at that particular position, and then after reducing it is polished. Next, there could be troubleshooting of the hard tissues. Now, the patient may complain that there is pain on biting. So you need to identify which area the patient is complaining on biting. So you need to check the opposing occlusion, any premature contact, and you have to check with the articulating paper on in the centric and eccentric movements also. Any interference in either of it, you need to identify that and remove that particular premature contact. Or if there is any excess of resin in between the framework, that could be also in the proximal plate or in between this proximal plate and the partial denture, that is the acrylic denture. So any excess of that material is trimmed off with a high speed burr. Once you have reduced that, then again place the denture and check for the comfort. Apart from this, there could be troubleshooting because of miscellaneous problems. The patient may complain of gagging. Now, this could be because of the overextended maxillary denture in the upper arch, where the patient has not become comfortable with that. So that overextension is removed using an appropriate abrasive. Another thing, there could be problem because of the cheek biting. Now, cheek biting occurs because of the trapping of the cheek mucosa between the posterior occlusal table, and this could be because of the improper placement of your teeth, and so that there is insufficient horizontal overlap. And how it is corrected? It is corrected by selective grinding of the cusp, so that you remove the interference between the teeth and the opposing teeth. And if the problem is mild, it can be corrected by grinding that cuspal region, that is the cuspal inclines, and if the problem is more, then in those cases you need to remove that particular tooth and reposition that tooth in a particular proper position. Patient may complain of tongue biting. Now, tongue biting can be because of the lower denture, wherein the teeth are placed more lingually, that is in the tongue space. So you need to identify that particular area where there is tongue bite, and you need to reduce that lingual inclines of the teeth so that there is no interference because of this in the tongue movements. And if the problem is more, like, then you need to remove the teeth and rearrange the teeth in a proper position. Another troubleshooting can be a problem with speech. With any kind of processes, patient may have some kind of speech problems because the contour is altered, that is of the speech area is altered, and the problem is mainly when we are replacing the anterior teeth. So if the anterior teeth are not placed in a correct position, then chances are that it is going to interfere with the speech of the patient, and patient may not become comfortable. Initially advise that you'll get comfortable with time, because initially it does happen with all the patients. So but if the problem persists and the patient complains of not having a proper speech, then the anterior teeth needs to be removed and they need to be placed in a proper position and then acrylized. Minor problems can be addressed by adjusting the contours of the processes with the appropriate abrasive. With this, we come to end of our video on troubleshooting in cast partial dentures. Thank you for watching the video.